want to start by introducing Dr. Leslie, who's a father and a doctor of physical therapy, founder of Quality Movement, PT, where he specializes in treating a wide range of conditions, including those related to pregnancy and general movement limitations. Dr. Leslie is dedicated to helping his clients take control of their health through education, motivation, and a positive mindset. He advocates for women investing in their body through thoughtful care, using his expertise to provide valuable professional guidance that prioritizes his clients' best interests, ensuring they achieve optimal movement and well-being without compromise. Please join me in welcoming Dr. Leslie.
I'm excited to be part of this panel. When I got invited, they really wanted a male perspective, so I'm honored to be here. And I have a lot of experience working with postpartum women, which I want to dive into in regards to the conditions that we see. So I'm honored.
Thank you. It's truly an honor to sit in front of all of you and have the opportunity to interview you and hear your unique perspectives. With that being said, as a physical therapist specializing in prenatal, peripartum, and postpartum care, how can physical therapy help women restore their core strength during and after pregnancy? And what are the psychological benefits of rebuilding physical confidence and stability in the postpartum period?
Yeah, definitely. I took a couple notes so that I didn't want to miss anything for you guys. So we help a lot with core strength, pelvic floor strengthening. So there's a couple key muscles that we work on. We do something called neuromuscular re-education. In layman's terms, we just help rebuild the muscles in regards to teaching that individual how to turn on that muscle again. Right? A lot of times when we go to the gym, we just, we're really doing like squats, bench pressing. Those are the big muscles you see in the mirror. But what about the small muscles, right? And that's where we come in as physical therapists. We got to teach you how to turn on those little guys. So when it comes to core strength, definitely there's a couple muscles called, one, transverse abdominis. And I'm a visual learner, so I have a visual here for you guys. I'm going to show you real quick. Multifidus and pelvic floor muscles. There's a lot of them, so I'm just going to group them as pelvic floor. So I show a lot of my clients this image here. So what we're looking at your
Teamwork.
So
Teamwork. Thank you.
yeah, I appreciate that. So I educate a lot of my clients on this. So we're looking at the deepest core muscles we have. And do you guys want me to stand up? Do you guys see this? Stand up. So essentially, I educate a lot of clients on this. So we're looking at the deepest core muscles here. So here's our spine, and a lot of times, have you guys heard of the condition diastasis recti?
Yes.
So that's something I see day in, day out. So essentially, it's just a separation of the lining of the abdominal muscle. And in order to cure that, or prevent it, this muscle right here, this big muscle, is the transverse abdominis I just talked about. And here's our spine. On the spine, this is like deepest core muscle, and this is like a God-given back brace muscle. So if you ever see somebody with a back brace, essentially it's to hold everything together, but we naturally have that muscle. So this is the muscle we work on training and teaching somebody how to turn it on. And on the back side, we have this muscle called multifidus. It attaches directly on the back of the spine. It does the same thing, it supports the spine, and then the muscles of the pelvic floor. It's important to work on these muscles because when these are not engaged or weak, our spine tends to flex over, and even outside of just diastasis recti, bulging disc, herniated disc, things that are commonly with back injuries, working on these muscles helps strengthen that. So when it comes to core strength, this is a depiction that we work on day in, day out. So I just want to show you guys that visual. Thank you for that. I just wanted to show you guys that visual in regards to what we do. And the other piece you mentioned, psychological benefits, right? Yeah, so psychological benefits of what I do, definitely when we work on the core muscles and stability, a lot of my clients and patients, they have improved self-esteem, right? When they start working on their core strength of their body again. Also, I wrote down improved mood relationships, right? Definitely how you put on your jeans now, that hits different. You're getting that core strength back. The ladies call it the snapback, right? Yeah. So that's the thing. And also just improve confidence picking up your kids. So it's something we talk about. They don't even feel confident just like picking up their kid because their back is hurting. They have that weak core strength, and we work on a lot of body mechanics, how to lift in our sessions, and also improve intimacy with their partner. Definitely ladies would mention that, painful urination or painful penetration. So that's something that helping full strengthening their ovaries.
Oh, that's amazing. And that is definitely a lot of things that women actually struggle with. So it's important for that insight that you just gave us and for women to know that, these are things that a lot of women go through after pregnancy. It's not a conversation that happens all the time. Sometimes there's a lot of shame associated with these things, some of the things that you just mentioned. But I thank you for that, so women know that it happens and there are solutions. Now, how do you incorporate education and mindset shifts into your physical therapy sessions to empower postpartum women to regain control of health and prevent the physical and emotional challenges that can contribute to postpartum depression?
Yeah, so definitely how I help women with that. Just kind of what I showed you guys, I show a lot of education visual. So in our office, we have a lot of anatomy posters. We have a life-size skeleton. I call them smooth bones, just to show exactly what's going on. Because when you are educated on your body in regards to how things are happening, why did they happen, that helps out mentally, right? And also in regards to what I do with clients, especially postpartum women, I tell them, take pictures of baseline, and then when we start our treatment plan of care, every 2 weeks, take another picture, right? But the very big key is that you have to be consistent with your home exercise program, right? And if you're not consistent with your home exercise program, you're not going to get the results. So I repeat, you got to be consistent with your home exercise program. And then every 2 weeks, right, objectively, because it's good to see the objective piece of your results. And take another picture in 2 weeks, and now you build that confidence, right? And like I said, things just hit different. Trying to clothes that you can feel confident in, and that has been a good game changer in regards to when I check in with clients every session. So and with our practice, what makes us different, we work one-on-one with our clientele for an hour every session. A lot of times with traditional physical therapy, and I say traditional because we're a private practice where we work for you. A lot of times in traditional practice, you go see a physical therapist for 10 minutes, and then it's like you get a hot pack where you go down and get passed to the intern. With our practice, it's highly focused care, so the results are definitely more efficient, and it allows that time to even, which these ladies are going to talk about the mental aspect as well. I get a chance to dive into that because we have that time with your provider. So to answer your question, and I don't want to make sure I didn't say anything, and I didn't. So
Thank you, doctor. Again, what you do is amazing. It's a pillar and a way to support women after pregnancy, especially going through so many changes. Navigating the body is just like, it's very difficult. So I thank you for the insight that you provided and the support that you provide to women on a day-to-day basis. With congratulations on the birth of your child. And it's nice. I think it's amazing, to hear your perspective as a male who understands and is able to empathize with women and just use your knowledge and your experience to put together personalized plans of care, right, and educate women and empower them to be able to, put themselves back in that or contribute their success to get back to that place of happiness, whatever that may look like for them is amazing. So thank you.
Thank you.
Kisha Heron, a licensed mental health counselor dedicated to fostering transformation from the inside out for women navigating challenges of pregnancy and motherhood. A graduate of Argosy University with a Master's of Arts in Clinical Mental Health Counseling, Kisha specializes in trauma, grief, and dual diagnosed disorders, including substance abuse and mood disorders, which are often pivotal in the prenatal, perinatal, and postpartum phases. EMDR certified and experienced in creating positive therapeutic relationships. Kisha is passionate about supporting mothers through these transformative stages, helping them heal, grow, and embrace the beauty of motherhood with confidence. Please help me in welcoming Kisha.
Thank you so much. I am excited to be here. We have covered so much already. And so I will try my best to bring everything together to send the practices that are on my guys.
Thank you, Kisha. We appreciate you being here and your insights. So thank you. Now, how do you support women experiencing trauma or grief during the prenatal and postpartum phases? And what role does EMDR therapy play in their healing journey?
Okay. So there's a lot of different parts to that. I will start with talking about what is EMDR in the first place. So EMDR is eye movement, desensitization, and reprocessing. It was started in about the 80s by this lady called Francine Shapiro. She was experiencing some anxiety one day. She went outside, she was walking, she came back inside. She said, "Oh, I'm feeling a little bit better." And what she noticed is when she was walking outside, her eyes were going back and forth. So eye movement looks at bilateral stimulation. If you've ever seen, sometimes they have them in movies, but you'll see clinicians, they use their hands and then say, "Let's do this." Follow your hands, go back and forth with your eyes. Or they'll tell you to tap with bilateral stimulation. What EMDR looks at is when we experience something like trauma, the question asked for my question, let's talk about what trauma actually is. Trauma is when you experience a painful experience and you have an intense emotional reaction to that painful experience. So everyone can experience something that is traumatic, but not everyone has trauma as a result of it. Your trauma is how you respond to the thing that may have been traumatic. And so we talked a lot about different traumatic birthing experiences that mothers have gone through. And so what EMDR does, because when we experience pain, we experience it in the right side of our brain first, which is the nonverbal part of our brain, which is more creative and more somatic. So I love how Dr. Catherine Pittman puts it when she talks about rewiring the anxious brain. She typically will say that your body responds to something way before your mind can catch up, or the cognitive part of your mind can catch on to it. So imagine walking downstairs in your basement, right? You see a coat rack. The coat rack has a coat and it has a hat on it. You go into the basement, the first thing you think is, someone's in my basement, right? But you don't realize no one's in your basement. It's just the amygdala, which is the emotional part of your brain, receives information first. So when we experience trauma or a painful experience, or as my EMDR consultant would call it, an emotional injury, we can loop that very thing that we've been going through. So imagine a mom had a miscarriage, or she had a difficult pregnancy, and now she's going back into another pregnancy or going back into the hospital. The hospital is a trigger. The pregnancy is a trigger. All the different things leading up to, if I lost the baby in 3 months, Every moment leading up to that third month is a trigger. Her body is responding, even if her cognitions know that I'm safe, I am well, but in my mind, I may hold, I didn't do a good job. I'm not a good mother. How could I not have been able to carry this pregnancy to full term? Right? So I have negative cognitions, those are what we call negative cognitions that replay in my mind. And so what EMDR does through bilateral stimulation, it helps us to better adapt the information that we're processing. Because we're stuck on one side, to experience true healing and wholeness, you have to have things go from the creative part of your brain, which is nonverbal, to the verbal part of your brain. Both parts have to communicate with each other. So bilateral stimulation, think about REM sleep, rapid eye movement. When you go to sleep, depending on what you ate, what you watched, or what you're consuming is what you dream about. And so your dreams is replaying and also reprocessing what it is that you're kind of looping. And so EMDR really helps with moms, communities who are dealing with emotional trauma or emotional injuries and they're stuck. And so what I do with clients is if they come to me, we're looking at how can I use EMDR to help you move past this moment in time that you're stuck at. Maybe you can't see the fact that there were other things happening with the trauma that took place with your pregnancy or with your birthing. And through EMDR, you're able to desensitize. So Dr. Leslie was talking about the physical aspect of it. You go through something, you cognitively know you're no longer in danger, but your body does not feel that. And so EMDR helps your body to feel that that thing that you've been going through is now desensitized. Dr. Vessel Bonnet Holt, always but he wrote the book, The Body Keeps the Score, which is what Francine Shapiro based her book on. Because what we know about trauma is that even if you know that you're safe cognitively, that's right, your body holds something very dramatic. Things are just as important as the cognition. And so we have to work things through our body in order for our mind to catch up. And so I use EMDR to help my clients who are struggling with these negative cognitions so that they can see the full story. And bilateral stimulation helps you to scan like the computer. If you think about your brain as a computer, when something emotionally injurious happens, you focus on one aspect of the computer. Bilateral stimulation helps you scan the entire computer system so that you have a more adaptive way of processing this information. And this dream as well. So, is that fine?
Yes.
Okay, so the other thing that I specialize with as well is grief. When we think about grief, we think primarily, I lost somebody has died, right? It was mentioned earlier that grief is also going from no longer being a mom, not being a mom at one point, to now being a mom. You are grieving your sense of identity as a person in a relationship who did not have this part. So if it's just me, I was talking to Dr. Leslie earlier. If it's you and your husband or you and your partner, you are living life, enjoying everything, right? And we're doing all this vacationing, we're traveling, we're like doing all the things. It's me and my boo. Then you have a little one that comes in. It's no longer just me and my boo. It's me, my boo, and this little child right here. And so things are different. You're grieving this relationship because now you have another person that you have to bring into the picture. And so grief is a huge thing. I think Megan had talked about it when she said bringing in, get back to your own sense of identity because we lose that. And if you are working and no longer can work, you lose that. And so grief is like a huge part of postpartum because we're looking at what is your now sense of identity because it has now changed. Not necessarily lost, but it has now it's changed, and we're navigating through a lot of that shame. So I talk to my moms a lot when they want to go out and have a good time. The shame and the guilt, mommy guilt, is what they always talk about. And I'm like, okay, well, we hold space for it, right? Because I don't also like to shame people for having their emotions because they're valid. And so we hold space for the fact that you're feeling the shame. We hold space for the fact that you're feeling the guilt. But what is that guilt and that shame trying to communicate to you? Do you need support? Do you need help? Are you overwhelmed? And so what we do is we learn how to be in relationship with our emotions, meaning even the shame, right? Because there's a lot of shame that comes with the trauma that is associated with postpartum. So that's like I think I answered all the
Thank you. That is so deep. And it speaks to what a lot of women, again, don't necessarily feel comfortable to say because of the shame that comes with it and the worry of judgment that may be associated with sharing that level of vulnerability. So for you to be in a position where you can meet women and mothers at that place and guide them to a place of hope, right? And provide them with tools that could be life-changing and long-lasting. I think that's very important, so thank you for that. My next question for you is, from your experience while working with the dual diagnosed disorders, what are some ways substance use or mood disorders can impact the postpartum experience, and how can mothers find effective support?
Okay, so let me, again, I'm like an educator. I'm going back to school to become an educator now. So I'd like to educate on the differences.
We can find for each other now.
So when we look at someone who's, so I'm also a substance use counselor. I did substance use counseling for 2 years when I first graduated from school in 2014. And when you look at dual diagnoses, you're looking at individuals who have a substance use disorder, and which means they meet criteria for a substance use disorder. And unbeknownst to all of us, we could all meet criteria for a substance use disorder because it's on a spectrum, right? It's mild, moderate, severe. If you engage in any kind of libations and you have increased level of tolerance, you can start to meet criteria. And I only say that so that it can take the stigma and the shame out of it, correct? And so in addition to having a substance use disorder, they also may struggle with a mood disorder. What is a mood disorder? Things like anxiety, depression, bipolar disorder. And when we talk about things being a disorder, there are a lot of different things and criteria that have to be filled in order to meet for a disorder to happen. And for a disorder to be a thing, it has to disrupt your home, social, or work-life balance. But let's be honest, within people of color, mood disorders also look different. Because when they created the DSM was modeled for middle-aged white men, not for Black and brown individuals, and not even for white women. So you think about it, you could be walking around with depression and not even know it because you show up for your family, you show up back home, you show up for work, but you go home and you really do not want to do any of those things. But you do it because you have to, right? You go home and you feel really hopeless, you feel very worthless, you can struggle with things like suicidal ideation. I like to talk about suicidal ideation because there is a passive and an active form of it, right? We all struggle with passive suicidality. And I say we all because there are probably times where you're like, it'd probably be a little bit good if I didn't have to do this, or what life would be like if I were not here. If you ever had a low moment of that, doesn't mean that you want to kill yourself. It just means that in this very moment, life does not feel as appealing as you would like it to feel. And so I say that also to take the shame out of the room for anyone who may also struggle with those type of things. And so when we deal with things like shame and insecurity and a lot of these negative cognitions, what do we want to do? We want to feel better. And so in order to feel better, some people will engage in things like drinking, smoking, snorting, shooting, all of those different things. And I say that to also take the stigma outside of addiction. Nobody, when they were 5 years old, and people said, what do you want to be when you grow up? I want to be an addict. No one said that, right? And so addiction also looks different from just substances. Are you addicted to behavioral things? Like, do you overspend? Are you addicted to people? People pleasing is a thing. It's what we people pleasing is a thing that looks at like codependency, my need to be needed, sustains something inside of me. Anything that I am doing, the definition of an addiction is I am compulsively doing a thing despite the consequences. So if I am shopping and shopping, my bills can't get paid, and I keep doing it, I have an addiction. If I am hypersexual and no matter what I am losing, I have an addiction. We talk a lot about gambling and drugs and alcohol, but there are a lot of other things now that's happening. Social media, the dopamine hit from likes and comments and watching what people are saying. And so when you think about postpartum trauma or grief, people do what they need to do to cope because your body wants to protect itself. Even if it's doing it in a maladaptive way, meaning it's doing it in a harmful way, your body wants to protect itself. And so it's going to do whatever it needs to do to protect yourself. So what I do in this is help individuals find different ways to accomplish the same skill. But I always say coping skills is a Band-Aid. So if you open up, you get cut, you put a Band-Aid on it, it's whatever. But if there's like an infection underneath it and you don't clear out the infection, then we have problems. And so my work is also like psychodynamic and at the core of me, I want to know what's going on in your childhood. I want to know what's going on with the things that you've been struggling with, what your attachment wounds look like, how you navigate the things from your past and how they're showing up currently in your present. And so, yes, we can talk about coping skills like journaling, breathing, meditation, exercise. What are some other things like talking to people, engaging in faith if you believe in anything or someone. But for me with EMDR, somatic work, and the type of therapeutic techniques or the way I conceptualize individuals, I want to know what's going on underneath. Because if I can clear out, or if we can clear out what's going on underneath, then your need for all of these coping skills or protective mechanisms are no longer needed. So a coping skill just helps you deal with whatever else is underneath that. So that's that.
Yes, thank you. That's really good. Thank you. I would like to introduce Dr. Latrice Wright, a dedicated counseling psychologist with a passion for helping individuals and families navigate the challenges of perinatal mood and anxiety disorders, particularly during high-risk pregnancies. Dr. Wright brings a wealth of experience from her work in both clinical and research settings. Her unique approach integrates liberation psychology, cognitive behavioral therapy, and family systems therapy, creating a holistic and empowering framework for her patients. With a deep commitment to fostering healing and resilience, Dr. Wright is a vital voice in supporting mental health during the perinatal period. Please join me in welcoming Dr. Latrice Wright.
I'll just reiterate, it's a glad to be here. so much has been said, and I don't want to be redundant, and so I'll kind of tailor my responses that way as well. So I'm very glad to be here. Thanks for the invitation.
Oh, it's our pleasure. Thank you so much. It's an honor to be able to speak with you and hear your insight. How do you approach supporting women experiencing perinatal mood and anxiety disorders, especially those navigating the additional challenges of a high-risk pregnancy?
Yeah, so I think it's interesting. So I'm actually in a unique position where I not only see folks outpatient, and just a disclaimer, you're gonna hear my southern roots.
We love it.
Yes. So I not only have the opportunity to work with folks outpatient, but I also work within the hospital as well as part of a member of the consultation liaison team with psychiatry. And so I have the opportunity to see them while they're pregnant. Then some people I see them when they just delivered, and then some people after they deliver, then I'm able to go back to seeing them outpatient.
That's nice.
Right, I love that, absolutely love that part.
Continuity.
Continuity of care, absolutely love that about my job. And so I think one thing, when approaching folks who are having like high-risk pregnancies, and so whenever we talk about high risk, those are things like preeclampsia, and they're already aware that maybe they have elevated, what's the word I'm looking for? Blood pressure, yes, elevated blood pressure, maybe gestational diabetes, maybe, so some people, they've been previously diagnosed with bipolar disorder, which potentially could lead to postpartum psychosis. And so we definitely want to monitor for those things as well. And so whenever I'm working with someone who's high risk, I always want to take a collaborative stance. Like, yes, I'll go to school, yes, I have some training, and ultimately, you're the expert in your own life.
Right.
You're the expert of your body. You know how you're feeling. I'm not here to minimize any part of your experience. And if there are little things we can do, little things that we can integrate along the way to help you with your journey, then let's do that. I also think that, so one of the things, especially with high-risk pregnancies, we talk about it a lot here, is the self-blame.
Mm-hmm.
A lot of the folks that I see, they're like, I did something wrong. What could I have done differently that would have, changed the direction of this pregnancy? And sometimes there are no answers.
Mm-hmm.
There are no answers, and helping them to come to terms with, sometimes we just don't know.
Right.
Sometimes you may need a C-section. Sometimes, your birth plan, we have all the plans in the world, and most of the time, our plans do not go the way we expect them to go.
Absolutely.
Right, and so having them to kind of come to terms with that. I think another thing is also thinking through, like, educating them about, and Kisha, you spoke about this a little bit, as far as symptoms of depression. How does that look different in women of color, especially Black women?
Amen.
Especially Black women. And so we know the sadness, we know the crying, but also depression may show up as irritability.
Yeah.
It may show up as headaches. It may show up as joint or back pain. It may show up as gastrointestinal, like stomach.
Yes.
So recognizing that could potentially be a sign of depression. And that could be something, of course, we want to rule out anything medical, so referring them back to their doctors, to their medical providers, but also letting them know, well, if they're not finding anything medically, do you think it could potentially be this? Or do you think it could potentially be depression or anxiety or a little bit of OCD going on? Or maybe a little bit of bipolar that hasn't been diagnosed yet? I mean,
It's reality.
it's a reality. And again, and I think that also speaks to the stigma within our communities as well, where we don't like to talk about things. And so asking them those questions. So in my intake assessment, did anybody in your family experience postpartum depression? And so maybe they'll say no. Well, was there ever a time where maybe someone had to take the baby from someone else for a while?
Yeah.
Because they couldn't necessarily take care of the baby? You know, like, how did that look?
Right.
Take me through all of that right there. I need to hear everything that happened. Did that person have an inpatient psychiatric hospitalization based on them not being able to take care of their child? Did grandma have to step in? Like, tell me everything that happened during that point. With high-risk pregnancies, also thinking about advocating, helping the patient advocate, because we know, and get into this a little bit later with the liberation piece, helping them advocate for themselves, because we know that obstetric racism, it is a thing. It is a thing. We know it. There's no reason. Like, let's just talk about it. It is a thing that happens. And sometimes even we as providers of color, as Black providers, we can sometimes minimize things as well with patients. And we don't do it intentionally, but I think sometimes we are trained in systems, like westernized systems, that ultimately end up having us repeat similar patterns. And so teaching them to advocate for themselves. Again, you're the expert. Are you writing down questions for your provider? Like, let's go ahead and do that right now. Let's write down about 5, 6 questions maybe that you have for your provider. Also, they're coming to me telling me, well, they're telling me they don't know what's going on. They're telling me I don't know. Okay, so what was your response to them? All right. Did you ask them, and I love giving this little tidbit now. Did you ask them, okay, what is the differential diagnosis? Because whenever you're asking a doctor, what is the differential diagnosis, you're asking them, okay, you don't know what it is right now, but tell me everything that it could be. And that way I can go and research it myself.
That's key.
That's key, being able to research it for yourself and then going back to that provider with a question. Right. And they're supposed to go through everything that it potentially could be. And even if they don't have an answer, that still is giving you information, you know, for you to kind of take back and take home to your family. Another thing I think is very important with high-risk pregnancies is me, especially being in the hospital, I serve as a liaison. And so having those conversations with medical providers about, okay, how do we implement trauma-informed care? This patient is telling me that they're feeling silent, like they're feeling like you all aren't listening to them. They're feeling like, so sometimes in the chart, you might see certain things like, oh, this person is aggressive or drug seeking, non-compliant, resistant. This is a difficult patient. So having those conversations with them about how it doesn't matter, you know, of course it matters what the chart says, and this is what we need to do right now in order to make sure that this person delivers safely and that they feel emotionally and physically cared for during their hospitalization. It's like you need to take your emotional feelings, because a lot of times we get calls or consults because we're trying to kind of appease their anxiety about the situation even more than the patient's anxiety. So sometimes they're feeling a way about something that happened during the delivery that they're trying to process. And so having those conversations with them about that as well. So those are just some of the things.
Oh, that's vital, and it's important for people to definitely understand what's being said to them. So I like what you said about providers speaking to patients and loved ones in a way that they can understand, right? Because when you understand, you can ask appropriate questions. So I like that, and I like how you touched on the suggestion to write down questions to ask your providers, right? And you also mentioned the same about being able to ask for information that you may need, even if, you know, I need to do some kind of direction. So thank you for that. Now, from your perspective, how can integrating therapeutic approaches like liberation psychology and family systems therapy help women and families heal and thrive during the postpartum period?
Yeah, and so whenever I talk about liberation psychology, this is just an approach that really recognizes that there are structural barriers at play. And thinking about intersectionality, I think that's kind of like a pop word these days, where where we're thinking about how intersecting identities influence someone's kind of just like path, their life path. So with me being not just a woman, but a Black woman, how has that interfered or helped me along the way? Like, what are the things that have contributed to me being a Black woman? And so just generally beyond perinatal care, thinking about being a Black woman, sometimes we're criticized as being aggressive. You know, where others, they're assertive. Some of us, we're hypersexual, or our hair, we're unprofessional if we wear our hair a certain way. And so we consider those things like gender racism, gender racial microaggressions, and things that are unique experiences for Black women. And so integrating that into psychology, how has your experience as a Black woman, like how has that informed your reproductive journey? You know, do you feel like you've been kind of like minimized or silenced in any way? Like, what has been your experience thus far? And having space for that, giving them space.
Yeah.
Especially, I see a lot of them, they just give this sigh of relief sometimes when they see me coming to the room, where I pull them from the waiting room, because they're like, oh, finally, you know, we have someone that I can actually talk about this with, and someone who will tell me that I'm not lying, and that this is really happening. That's why I'm like, I'm gonna be the first one, like, yeah, that sounds racist to me. I don't like, that does sound pretty racist. And we know that these situations, we know that racism exists, and how can we prepare you to deal with this on a day-to-day basis? How can we make sure that you're prepared? So whenever you're going to your appointments, how can we make sure that you have your weapons in order to deal with these providers? And so that may look like, again, taking notes, asking certain questions of the providers. I think also thinking about communal support is very big in liberation psychology, and with our population, and with them being high risk, and then a lot of them low SES, there are just a lot of psychosocial stressors and barriers. Communal support is so important. And so are there ways, like, even if, like someone mentioned earlier, grandma has to go back to work, so she can't necessarily help you with the child, like, are there other avenues? Like, are there other resources that we can connect you to within the community that can get you some of that additional help? Like, maybe you need SNAP benefits, or maybe you need a nurse that can actually come in and do home visits, right, to kind of give you a break.
Or a doula.
Yes.
Postpartum doula.
Yes, a doula. Doula. And connecting folks with doula. I think, what is the citywide doula initiative?
They have that too.
Yeah, and so connecting them with those types of resources as well. And then on the other side of it, so I am a licensed marriage and family therapist. So thinking about the family piece.
Yes.
That's vital. It's very important.
It's the foundation.
Right there.
So yes, but thinking about the family piece is also very important. So whenever I'm working with people, like, what's the intergenerational birth stories? Like, there are certain cultural traditions that we pass down. There are certain cultural traditions that have been passed down, and it could be culturally as a whole, or things that are just for your family, that your family does when someone has a baby. And so, or even if it's where the whole town celebrates whenever you have a baby. Like, I'm from a small town, and so typically if someone has a baby, it's like a community event. So what are those things that we're passing down, and how can you latch on to some of those things from your family? You know, even if we have to go through and we talk, the technical term of it is a genogram, but I just like to call it family tree. So maybe we'll create a family tree, and so you can see, like, oh, well, great grandma, she actually experienced perinatal loss, or she actually did experience postpartum depression. You know, so how can I potentially prepare myself for that? And are there other stories that great grandma had that she can pass on to me? We're kind of like thinking about instilling hope and joy through that oral tradition of passing down stories as well. Also, so it can be a thing because on the one hand, it's a joyous occasion, and sometimes family, they can get on your nerves. They can just outright get on your nerves, especially when you have a new baby, because they want to tell you how to do things exactly. So yes, hold on to those traditions, and at the end of the day, this is your baby.
Right.
You have the right to raise your baby, even if it kind of veers off of that tradition a little bit. And you don't have to feel shame about that, you know, or guilty that maybe you don't want to breastfeed this long, or maybe you don't want to breastfeed at all. Maybe you just don't want to breastfeed, and that's okay. That's okay. You're creating your own way. Also defining expectations. So maybe you have a child. How are you going to now fit another child or additional children into the home? What's it going to look like for you and your partner moving forward? And these are things that have kind of already been said. And so moving on to the couples piece, having the partner recognize that they're not only there for financial support, they can be there for emotional support as well, you know, and that would be appreciated. Like providing that reassurance, you know, and being vulnerable with your partner. So having, like, whether it's the father of the baby or whoever the other partner is, you know, just having them say, baby, I'm scared too.
Yeah.
Like whenever I see that you're sad, whenever I see that you are not able to get up out of bed, or whenever I feel like you're being irritable, it makes me scared. It makes me anxious, you know? And so being vulnerable with your partner about what you're experiencing, because you don't necessarily have to be like this stone image, because I think a lot of people sometimes they get it in their head, well, if I show that I'm vulnerable, then that means that I'm not showing up for them, you know? And so having that conversation with them as well. Talking through decreased intimacy. We didn't really talk a lot about sex today, but we talked about it a little bit.
That's
so
it happens.
It happens. It naturally happens. And so talking that through with the couple, like there's not going to be any sex for some weeks. So how are you all going to get through it?
Yeah, non-penetrative. That's right.
So that's the
You
thing.
can still have fun.
Yes.
Yeah.
Having
That's
them
right.
recognize that intimacy doesn't necessarily mean penetration.
That's right.
There can be massages, there can be all of these things, kisses, little games. You know, I've had one couple create like a sex meal where they have appetizers. You know, so they come up with appetizers that aren't section, that aren't penetration, but it's kind of like setting the tone for the experience. Then they come up with their entrees, which is the actual so they come up with their entrees, which is like the actual sex or penetration or whatever they would like for it to be. If that's mutual masturbation, whatever. Dessert. I see. And so dessert, that could be something as simple as aftercare. You know, and so once you finally get to the point where you're having sex, then you pick something from the dessert menu where that's aftercare. Is that maybe you washing the person off with a towel, you showering together, you know, whatever you feel can kind of help conclude your experience. You know, and so just really taking their time with it in order to increase that intimacy, even though it may feel as though the intimacy has decreased because they're not having like penetration. You know, so that is what.
That was good.
My favorite thing.
it's true, it's really true, and I think, you know, that happens. You know, a lot of, listen, one thing I definitely feel sitting here listening to everyone is that we have touched on some topics that people typically do not talk about when they speak about pregnancy, postpartum, even pregnancy planning. And I hope that everyone walks away from here just really feeling like just reminded of how important you guys are. We all are, right? We're here together, a bunch of powerful people with the greatest insight and exclusive perspectives, right? That we all share, you know, and can relate to. And I think that's vitally important, and I hope that this conversation keeps going. I can't wait to learn more from you guys. Like, it's so important. And I think, you know, we all need to just recognize that it takes a village, right? And this is just one part of our village. And things like this get everyone together, and we grow, and we share. We're gonna walk away, we're gonna go tell people about how the night went and what we learned, and things like that. And I think that it's important. So thank you for that. Thank you everyone for being here.
You did an awesome job.
Thank you. It's really an honor to sit here and listen to everyone exchange ideas, right? The conversation, listen, I could listen for hours, right?